This is Lauren Dunlap, Executive Director for Advocacy and Awareness for Immune Disorders Association, or AAIDA, in Charlotte, North Carolina, and I am so pleased to host tonight's webinar in partnership with PANDAS Network. AAIDA's mission is to advocate for patients living with primary immune deficiency, secondary immune deficiency, and autoimmune diseases to create awareness and conduct research to find cures for these different groups of diseases. We would also like to thank Allergy and Asthma Network for their continued support with AAIDA and assisting us with educational webinars such as this. We are very excited tonight to be presenting AAIDA's third educational webinar for 2020 and to be joined by Amy Joy Smith, a nurse practitioner, and Diana Pullman of PANDAS Network. Amy is a nurse practitioner who received her BSN in maternal child nursing at Syracuse University School of Nursing, and all of her acute care and hospital experience is in pediatrics. At the University of Minnesota, she was a fellow in the World Health Organization's renowned Adolescent Health Training Program medical school, and in addition to being a nurse practitioner, has a master's degree in adolescent health with a focus on youth development and community health. Amy specializes in functional medicine at Integrative Medical Institute of Orange, California, and has been treating pandas for over 10 years. She is a renowned pioneer in the pandas front who limits her work exclusively to PANS and PANDAS and Lyme cases and takes a holistic approach to medicine with experience as a clinical nutritionist. She is also the mother of an amazing child with pandas and a dedicated pandas awareness advocate. Diana Pullman is the founder and executive director of PANDAS Network. 14 years ago, her 7-year-old son had a sudden alarming change in personality following a strep throat infection. And a few years later, it happened to her younger daughter as well. She established the organization to bring together researchers and doctors interested in studying this illness. PANDAS is now recognized internationally, and there are research efforts worldwide. Diana's children receive treatment and are thriving as young adults. Amy and Diana, please begin.
Okay, I'm turning on my camera and very, very happy to be here. Thank you so much, Lauren, for inviting us and for helping us to spread the word about PANDAS and PANS, which is a kind of autoimmune illness that creates autoimmune encephalitis in children. So thank you so much for having me.
I'm going to bow out. Thank you, Amy. Nice to see you.
All right, I'll see you later.
I'll see you at the end. Okay, bye-bye.
Absolutely. Diana is the executive director of PANDAS Network, a nonprofit patient and family advocacy group on the West Coast or out of the West Coast that works nationally and internationally. And we're all about raising awareness. And that's, again, why we're so grateful to be here today. I'm so sorry, I have to do something with this here. Okay, the panel was in front of my slides. Okay, I'm sorry, I'm just getting the technology down, so I apologize for that. Okay, as a, I don't know how to make this go away. I am so sorry. I'll put that way down there. Okay, great. Sorry about that. I'm just getting the technology. Okay,
Amy,
so
if you touch the little orange arrow on the control panel, it will disappear.
Got it. Okay, well, I think I disappeared it as good as I need to, and thank you very much. Sorry about the glitch. Okay, so I've been a nurse practitioner for quite a long time, and as Lauren said, my practice is 100% treating children with PANDAS and PANS, which started in 2010. I've treated about 700 children. My son developed PANDAS on July 7th, 2006. He developed intense symptoms overnight, just like what Diana was saying about her child, and from which these symptoms he could not recover on his own. And knowing what I know now about PANDAS, and we'll talk about that, those that is what happens, because when children are young, they're already developing the predisposition for having these kinds of unusual responses to infection. But the early episodes tend to resolve on their own. The inflammation of the brain, they're able to resolve it. But then all of a sudden, one day, something happens and the big break is what we call it. And he had that on July 7th, 2006. And this is him right before, over here, the top picture on the left. And then this was him at the picture below just a couple of months later. And you can see a radical change in his just being in his body, the look on his face. And we took him to Kaiser emergency room, and they started talking about my autistic child. And I told him he for sure was not autistic, and they said, well, it's late onset autism. But they treated me like I'm not a professional, intelligent mother that had that child for 10 years. And I really would have noticed if he'd been like that. When I told him he wasn't like that just, weeks ago, they didn't even believe me. And that's the hub of the problem. Because the hardest part about treating PANS or PANDAS really is recognizing it, because it looks like a lot of other things. And this is a picture of my son at 4.5, and you can see, again, that same dark look that happened. It kind of came for a few days. We didn't understand it, and it went away. And I really think this was one of his very early PANDAS episodes. But it happens to plenty of children, because the National Institute of Mental Health believes that as many as 1 in 200 children may have infection-triggered neuroinflammatory illness or autoimmune encephalitis that looks like neuropsychiatric disorder. And that is a lot of undiagnosed and misdiagnosed children. And if you compare that to other common chronic childhood illnesses in the United States, it's really up there, right? 1 in 200. The only ones that really top that are asthma, which is really very prevalent in the US, 9 children out of 100. And then on the very bottom, you can see developmental disabilities in the United States. That's autism spectrum types of disorders, 1 in 6 children, which is really high. And then mental health issues, this is a brand new pre-COVID statistic. 1 in 5 children in the United States have a mental health issue, diagnosable. So this is PANS. PANS is a large category, and then you can break it down. PANS means pediatric, acute, sudden, neuropsychiatric, syndrome. They just throw syndrome on the end of things that they don't understand quite yet, right? And if you think about it, there are definitely non-infectious triggers of things that can affect kids' brains. For example, they could get under the sink, right? That's why we put the little child-proof things. They could eat bug spray or some kind of cleaner that causes brain inflammation. They could be exposed to pesticides down the street or while playing in a lot, or even at a park or someone's home, or mold. They could, who knows, sometimes what kids put in their mouth. They could also have just a metabolic illness, a child with diabetes. It's going to change their behavior because of this up and down blood sugar. Other kinds of autoimmune illnesses, you're going to see that as well. So then there are also times that infection can cause these things. For example, they could have meningitis, or they could have a virus that's inflaming their brain or infecting their brain and nervous system, right? Or they could be bit by a tick or a mosquito that's carrying Lyme or some other infection that can actually cause an infection of the brain and the nervous system. So you're going to see those same kinds of symptoms. And then there's a time where these symptoms are caused by group A strep, and it's a special mechanism that we're going to talk about. And that's when it's called PANDAS. PANDAS is, I just realized I didn't even have it on here, pediatric autoimmune neuropsychiatric disorder associated with strep. It's PANS from strep. Okay. And PANDAS is actually rheumatic fever of the brain. And if you We all probably know, you may know someone in your family, your mom, maybe a grandma or a cousin, or maybe even a sibling, depending on which generation you are in or where you live, that has had rheumatic fever. And most of the time we think about how rheumatic fever affects the heart, or it can affect the joints, cause rheumatism, right? Or even the kidneys. But PANDAS is when the rheumatic fever is in the brain. And what happens is there are certain strains of strep that are very virulent, and they're tricky. And they know how to trick the immune system into attacking the person, the child's own cells and tissues. And how they do that is they're able to put these proteins on the surface that look like the person or the host cell. Then the immune system sees that protein sequence and attacks the cell and leaves the infection. It's called molecular mimicry. It's a very sneaky process. And when it happens in PANDAS, the child's brain becomes inflamed, and the inflammation is what causes the symptoms. The part of the brain that's affected are called the basal ganglia. It's a group of structures deep at the base of the brain, and they have these clusters of neurons that go all over the place, to all different other parts of the brain. And it's almost a gateway, right? So the basal ganglia are primarily responsible for motor control, but have a lot to do with learning, cognition, executive function, behavior. And studies have shown for a long time that if someone has damage to the basal ganglia, it can lead to repetitive behaviors, like tics, right? Repetitive motor movements, and also repetitive thoughts, like OCD types of thoughts, by something called cortical basal ganglia loop dysfunction. So then PANS, pediatric acute neuropsychiatric syndrome, simply means that whatever it is you're seeing in this child likely has a physical cause and warrants a medical workup, right? But that's not usually what happens, because children develop these symptoms, they have some exposure that is probably not on anybody's radar whatsoever. All of a sudden the child shows up, they're acting really differently, it may be extreme, they're falling apart. We'll talk more about the symptoms in a few minutes. And the parents take the child to the doctor because everybody's alarmed. Child, this isn't my child. And the parents are told this is a psychiatric problem, or it's behavior, or it's a conduct disorder, or it's your fault. And they're sent off. And very oftenly they're sent into psych. Children are started on psych meds, which can be a roller coaster, right? They start one, they don't know the right dose, then it goes up, then they add another one, and they just get lost in a maze. And the older kids often will withdraw, they'll self-medicate, they'll get into different kinds of problems because it really looks like a psychiatric problem. Most of the time, the diagnoses really are psychiatric, and it makes sense unless the person has their full thinking cap on. Because what's so interesting is that if you look at this great study, 700 children, this study was published at the University of Buffalo, or University of New York at Buffalo a few years ago, and they looked at 700 children. Only 5% of kids that went on to develop PANDAS and PANS had a pre-existing psychiatric disorder or diagnosis at all. So it really didn't fit who they were, right? Which is a defining feature of PANS or PANDAS. But if you look over here on the left side, frequent chronic infection, allergies, frequent sore throats, there you're getting up into high percents of children that have some kind of immune thing going on. Most common neuropsychiatric symptoms in children with PANDAS and PANS are going to be OCD and anxiety. But you're also going to see really interesting things, like kids are going to act like they're much younger. They're going to do baby talk. Kids that could feed themselves, dress themselves, button their clothes. All of a sudden, they're unable to do those things. They don't know where they're putting stuff. They're discombobulated. They're not themselves. Many of them, all of a sudden, are afraid to be away from their parents. And a lot of families are sleeping with their children. The children are, back in their parents' bed. There are cognitive problems. It's hard to concentrate. They lose their reading, their comprehension, their math skills, and very often really high just functioning kids or normal functioning kids, all of a sudden the teachers are saying, what's going on? Johnny's not doing his homework. He's not paying attention. He's acting out in class. He's not being himself. And one of the things that really stands out with children with PANDAS and PANS is this terror-stricken or hyper-alert appearance in a lot of children. And that really crosses over to these very wide pupils. Their eyes are normally quite dilated when you look at them, and it just looks like these black holes, and they look just terror-stricken. Other common physical symptoms, movements, repetitive movements, or random movements. That strep can cause a type of chorea, which are these random uncontrollable movements in children. You see a true deterioration in coordination, especially fine motor skills. Some children can no longer write. They develop dysgraphia. They have stomach aches, body pain, because strep can most certainly do that, and other infections can cause pain, like viruses can, or Lyme, fatigue. They develop sensory issues. A lot of children en route to getting an ultimate PANS or PANDAS diagnosis end up with a sensory integration type of diagnosis, but it really affects them. This is such a great slide because it shows how kids change. So June 2006, these are real pictures from a child drawing a picture of their doll, all right, while they were in an acute PANDAS flare. This same child, 3 months later, after treatment, you can see how their brain reintegrated, and their coordination, their spatial relationships, everything about this slide demonstrates the healing that happens with appropriate treatment, which is immune treatment. It's immune-based, not psych med-based. Psych meds can reduce some of the symptoms, you know, so that they're not maybe a danger to themselves or to their families, but it doesn't cure the problem, and that's the problem. Diagnostic criteria for PANDAS and PANS are very, very specific. It's a sudden, often explosive onset of symptoms, or for a child who's had PANDAS before and they're in a remission, it could be an explosive worsening of symptoms. And either OCD, obsessive compulsive disorder, and or severely restrictive eating problem, and or motor tics need to be present. Those are heralding symptoms. And the severely restrictive eating is different. It's not the kind of thing where you would typically see anorexia at an eating disorder clinic where people are afraid they're fat, even though I have had a few kids who begin to have obsession about them being fat, but most of the time, that's not really the problem. The restrictive eating that I've seen is really different. For example, they're afraid they're going to choke. They're afraid there's germs in the food. Someone touched the food. They're afraid of white food or this texture of food, or they're afraid they're going to throw up, or they're afraid to swallow, or there's some other thing going on. It happens in children, prepubertal onset, and it has a relapsing and remitting course, especially early on. It's either there or it's not there. Later on, once kids have had PANDAS for a long time, for example, my son, when he developed that big one at age 10, he never would have gone all the way back to where he was, where the symptoms were gone at that point without treatment. So it can change their baseline over time. And that can make it more difficult for older children to be diagnosed properly because they're down the road and their brain inflammation has been present for so long that they haven't been without treatment, right? That's why you need a really good history, right? And if it's PANDAS, there's a association with strep, whether or not you know it. And a lot of times parents don't even know it. Oh yeah, he was sick, or he had a stomach ache or whatever, but who brings their child in? Unless there's a real reason. Most people don't bring their child in. And so PANDAS and PANS are called clinical diagnoses of exclusion because there's no 100% accurate and specific diagnostic test that's made for pandas and only for pandas. That's widely available, although markers have been determined, and Diana's going to talk more about that. They're still in research status. All right, so more to come on that. But the problem with this is summarized by this great study at Johns Hopkins that was put out in 2015. It was a review of 238,000 encephalitis cases from 2000 to 2010 in the United States. These are primarily hospital-based cases. So you know that these people had the workup, every possible thing. They had every study and every test and every blood test and every imaging and everything. And 50% of the time, they never found the cause, right? So in other words, we don't have the technology necessarily to fully determine the cause of encephalitis. And so physicians that don't really understand that part, even if they might at a certain point just go, okay, fine, you know, to the parents, I don't really know about pandas, but I'll go ahead and test for strep. And if the strep is negative, they say, oh, okay, well, it can't be that. But that's not necessarily true at all. The strep could be completely gone, or it could be something else at that point. So the burden falls on the children because of that. So diagnosing pandas, again, a diagnosis of exclusion. If there's something else, it could be that. You know, and I used to work at Boston Children's Hospital in neurology and neurosurgery right out of college for some years. And, you know, if a kid came in with these kinds of symptoms or behavior, I mean, they'd work them up for like a brain tumor or, you know, something else going on in their nervous system. So, you know, certainly doing imaging studies, lumbar puncture, MRI, PET scan, all those things, especially if symptoms are severe, are really, really impossible. However, the current imaging contrast materials do not detect the subtle brain inflammatory changes with pandas. We need something special in order to do that. We'll talk a little bit more about lab testing and looking for triggers. But the main thing with pandas, especially because it's a clinical diagnosis, is that it's always in the story. You know, I could sit down for an hour and a half or 2 hours and go over every single thing about that child's history that those parents can recall and look at every medical test that was ever done. And I can get a pretty darn good idea by the end of that conversation whether it sounds like it's worth working that child up for pandas or PANS or not. Because not everybody has pandas or PANS. Someone could be bipolar, you know, or have other actual mental or other illnesses. So I tell everybody, write up a timeline, take video of your child when, you know, they're this way, then they were that way, or they're moving that way, or they were acting like this. Take videos and bring those to the provider. Write up a clear timeline. And then I'm always listening for those early transient episodes. Yeah, that happened, but then he got better, you know, or other people in the family that were sick at the time that child ended up having that symptom onset. Because like one situation, the mom was so concerned about her other child and that child's illness that it was hard to get the history of the child that I was working up, but I wasn't aware of the sickness of the other child at the time. And I kept going back because I couldn't put it together. And then finally the mom said, you know, this is really blurry because my other child was so sick. They had, I think it was strep and something else, but they were just physically ill. But the patient they brought to see me wasn't physically having those symptoms. They were mentally having those same symptoms. It's really, really interesting. This is a good test. It won't catch it 100% of the time. That's the problem. But because it could be too late. The antibodies might be gone by the time you do the test. But it's out of the University of Oklahoma. It's called the Cunningham panel, and it looks at these 4 tests here, or these 4 here, anti-dopamine receptor 1 and 2, anti-lysoganglioside or tubulin antibodies. These 4 are antibodies against certain brain proteins that the child is making. So that's autoimmune, right? Encephalitis, right? Attacking the brain. And then this one here, the CAM kinase 2 that's elevated, and here you see it on this little graph, it well into the red zone. That demonstrates that there's a breakdown in the proper signaling through the blood-brain barrier. That is the definition practically of this right there. So scenario 2, okay. You have scenario 1, it could be all the same, the kids are out there, but at a certain point, somebody can't stand it anymore. Either the psychiatrist is like, they just can't handle the ups and the downs and the family and the kid and the suffering, and they just say, okay, something else must be going on here. I can't do this anymore. Or the parent is up all night long on the internet, which was the case with me for 3 years, trying to figure it out. It was a long time ago. When I was dealing with it, you really couldn't find it online, but now you could go on and say, overnight change in my child, something's happened to my child suddenly, you know, has anxiety or OCD, and PANDAS will come up. So parents find it, they call the doctor, oh, doctor, this is amazing, I think it's PANDAS, or they have Lyme, or something's going on here, but the pediatrician maybe never heard of it, or they don't believe in it, or there's some controversial stuff over some years, and most providers, unless they actually read the medical literature these days, which a lot of them really don't have time to do, they're still stuck on that was, oh, I don't know if there's such a thing as PANDAS or not. So people end up traveling huge distances to find someone, and it can take a long time. In fact, in this particular study, it took 35% of these kids over 3 years to get a diagnosis, and only 31% were diagnosed in less than 6 months. And that was the smallest category. It was under 6 months. That's not okay, right? They see a lot of different doctors. This 51 children in this study, it took 343 healthcare providers to diagnose them properly with PANDAS or PAN, and they drive far. I have patients come to me from all over the world, and they spend a ton of money out of pocket. Us, we were a statistic. We were a total casualty of PANDAS and PANS. My son was sick for 3.5 years before I figured out what it was. Then it took 3.5 years to get better. By then, I was divorced. My entire life savings were gone. Our inheritance was gone. We lost our house. I was bankrupt. People stop talking to you when you're stressed out all the time and your kid is sick and they can't fix it. You know, my cousin actually stopped talking to me for 2 years, and she was one of my best friends, because her husband was a pediatrician at Kaiser, and he said, oh, she's doing IVIG or whatever. There's no such thing as PANDAS. This was, 10 years ago or 11 years ago, and she stopped talking to me. And that happens to a lot of people. And you know what? Then she saw a write-up in it was either the Wall Street Journal or the New York Times, and then she called me, oh, PANDAS. By then, I was like a different person. I was a shell of myself. But how could that have been different? If any, and we saw so many different kinds of providers. We actually had a shaman come to our house one time. I mean, we did so many different things, right? But instead of, there I was a parent, I was asking questions, I was bringing research, do you think it's this, do you think it's that? And it's hard for doctors to be approached that way. They like to be the one who knows, and they like to actually be the one in control. And instead of being curious, they just put up barriers. And I'm not the only person that happens to. In fact, there have been parents that lose their children. There are parents, CPS is investigating them. Just this month, I actually have 2 parents. One CPS, I was able to talk them out and down, but one of them, CPS investigating them. They've been called bad parents. Munchausen, right, where you make your kids sick for your own personal mental reasons. Child abuse, it happens. Parents are exhausted, they're struggling, they're losing life as they knew it. Their dreams are slipping away, right? And many are suddenly homeschooling sick children. And this is pre-COVID, right? Now everybody's homeschooling their children. We're talking about for years. In fact, twice the national average of children with these diagnoses are homeschooled, and 8% can't even go to school at all. They can't learn anything their OCD or their illness or their physical symptoms, their anxiety or whatever they've got going on is so severe that they've lost their cognitive capacity for a period of time. Goal is obviously child is exposed to whatever, goes to the doctor read the literature or got those CEUs and said, wow, maybe this is that. And they test the child, they treat for PANDAS, and it happens quickly. And the benefit of quickly is that, remember, we've talked about that baseline drift, right? Like they get strep or whatever in the beginning, then they go back to their baseline. Then it probably happens again, they go back to their baseline. But the next time it happens, it's hard for them to resolve the inflammation on their own, right? Like sometimes I use a metaphor, something like, what if you, twist your ankle, right? You twist it and it's all swollen and everything. It takes a while for the inflammation to go down. Then you twist it again, the exact same way, right? Maybe it still gets better, right? The inflammation resolves. But what if you do the same thing again? Maybe it'll even break that next time. And maybe the tissues are going to have a hard time resolving all those inflammatory changes and fluids and all that stuff. It changes the cells. We want to protect children from that, right? There are so many costs to waiting to treat. We don't even know what the long-term physical cost is to their actual brain, right? When you think of just the life cost that is lost to the child, because some people say, oh, most kids grow out of PANDAS. You don't even have to treat it. But meanwhile, even if that was so, which mostly it isn't, or it probably is some % of the time, but then you have kids that couldn't go to school. You have kids that never learned how to just be healthy and happy and social properly, and they've never made good connections, and they've never, learned how to develop self-esteem and think out problem solving. It's a terrible thing. And then families break down, right? And sometimes a child can become incapacitated as an adult. Some of them get into trouble with the law. They self-medicate, right? Some kids have been known to commit suicide, right? Because they just can't stand it anymore. And a lot of them are still blamed, right? So I wouldn't count on it. This is just an interesting case study. His parents they're about to send him to Utah, to one of those bad kid camps or schools. And his mom read something about PANDAS, Stephen. He was 17 when I met him. The main part of this slide is that when he was little, his history had a lot of illness. 1 to 5 years old, lots of fevers and infections. They were living in Thailand during that time. He never was treated for anything. But mom reports episodes where he was doing well, and then it would change all the way back. That is such a hallmark of the kind of thing that you would hope to hear, right? To help you define whether a child has PANDAS, good and bad seasons. Okay, when he was good, he was hanging out, he was reading, he was playing baseball on the team, he was cuddly, and when he was bad, he was kicking holes in the wall. He was actually kicked out of school. And but interestingly, when he was 15, he was on doxycycline, an antibiotic, for his acne, and it was the best year that he'd ever had, like ever since he was 8. So that was definitely compelling. He was diagnosed with a behavioral problem, not psychiatric problem. And so then mom contacted me. He was loaded with infections when I saw him. He was actually sick. He had strep, mono, he had pneumonia, he had a sinus infection, and a severe gluten autoimmunity, the kind of with the antibodies that actually attack the cerebellum. Like it actually can attack the brain, right? We started him on treatment within 2 days. I spoke to his mom. She said that there was a softening up of his mood just in 2 days. By 2 weeks, I saw him. He was actually present. He was hopeful. He was starting to think that maybe there might even be a future, even though he was still quite volatile. 2 weeks, right? And then they traveled over the summer. His mom ended up getting really sick, and he ran out of meds. And over the course of like July, he lost all of the gains. He went right back because it was too soon. to stop the treatment. The inflammation had gone on for so long that he couldn't hold that on his own after just maybe 3 months of treatment. So I got this letter from the mom and I said, please let me do IVIG, just because insurance was going to cover it. And this is what she said. The nature of this disease is so complicated that the manifestations of PANDAS are not his fault, but his behaviors are unacceptable and create deep traumatic wounds for all of us. And that's what happens. Well, we ended up doing 2 IVIGs, 3 months apart, and November was IVIG number 2. By December, a month later, he said, I'm more like myself, solid in my skin. He was a different person. A few months later, they actually let him back into school, right? And he went in as a second semester, graduating senior. He graduated, he went to community college. He's doing well, right? So here was one option for his future, and here was his other option for his future, defined by immune treatment, not psych meds, right? It's amazing. I'm going to show you this other older kid case, because a lot of people say, oh, you can't treat older kids. But Amanda was 20. When I met her, she was sleeping with her parents. You will see why. This is a wonderful video that is in our documentary.
Can't hear it, Amy.
Oh, it's all the way up on my, oh no.
Not working.
Hang on. So you're not getting this,
No.
hang on. I don't know how, if someone can tell me how to do it, then I don't know how to do it.
I think you just go on to
Yeah.
the next.
That's fine. Okay, that is perfectly fine. And I'm gonna show you something. This is her at the end. Okay, just with treatment. Oops, I am so sorry, I just did that. Oh, all right, I am very sorry. I was just trying to get out of that slide. All right, we are gonna fast forward through most of what I have here because you have the information available to you. Oh, not that one. Okay, PANDAS treatment is based on principles. Identify and treat or remove infectious or immune triggers, reduce inflammation, and consider immune modulatory therapies. These 3 are highly accepted by regular medical providers. Anybody that treats PANDAS knows identify and treat or remove infectious or immune triggers while reducing the brain inflammation and consider immune modulatory therapies. This is the way that I work it up. I do a very wide net. You can look at this later. I'm an integrative provider. I work on the gut and the microbiome, but it's so far beyond anything we can actually talk about in this seminar. But do yourself a favor and look into that for your health and any of your children's health if you have not. Reducing inflammation, most of this is very well accepted. I put some herbs in here that I use. This is Stephen Blaylock. He's a neurosurgeon for the Pittsburgh Steelers. He uses these for people that have brain injuries. Herbs can work very, very well in certain circumstances. I also use something called low-dose naltrexone, which is immune modulatory and reduces inflammation. And it can work really well for autoimmune illness. IVIG, I believe very strongly in it. Not everybody needs it, but if you can identify and treat or remove the infectious or immune triggers and get them into IVIG if they're not recovering on their own, I've not had it fail. Most of my kids are 1 or 2 and done if I'm able to clean everything up ahead of time. And I find that if IVIG doesn't stick, there's a reason. There's some trigger. Maybe they need their tonsils out, they have a dental infection, a gut problem, a different thing, they're living in mold. You know, there's something else happening. Not going to really go into this too much, but this is a young boy. He was diagnosed with autism at 3, and then at 3.5, they started biomedical therapy, and he was doing very, very well. And then he suddenly declined. They tested him for strep. They gave him Zithamax because it was positive. It brought him practically completely back. And then they did a series of high-dose IVIGs, and he lost his autism diagnosis. I'm not saying autism is PANDAS and PANDAS is autism, but there's a decent percent of kids with autism that maybe it's because of the immune issues or the blood-brain barrier that can cause problems. Okay, I work very hard. You can actually look at these things to reduce the symptoms. I work to reduce stress, reduce anxiety, support sleep. You're welcome to this information on the recording because there's a lot that you can do. And I just wanted to share information. I have a ton of information on here about reducing inflammation with nutrition and using food for brain food that help nourish the tissues of the nervous system. And I'm giving it all to you. If nothing else, you can teach your child the rainbow diet, right? It can be very, very successful. Kids love color, and you can make it a game. These are brain healing diet principles adapted from a colleague of mine who works on healing traumatic brain injury. And I really think PANDAS is maybe a chemical traumatic brain injury. So these foods can really help the cells to recover. And recovery is really important. Supporting the family, cognitive behavioral therapy, family therapy, helping parents to stay strong. I would love for parents to find a way to not go down as hard as we did, you know, by reaching out for help sooner, you know. There are a lot of parent support groups, both in the United States and abroad. PANDAS Network has a lot of information at this link for parent support groups, and are really the hub of a ton of information. I know I'm eating up Dinah's time at this point. We've got books for kids. There are more than this, and books for educators. These are fantastic. Talk about educational accommodations to help the changes in kids' brains that happen while they're flaring. Books for parents, there are more. And above all, just never give up. And there you go.
Never give up.
Never give up.
Thank you. Okay, very good. We have to have you do a special dietary only conference. Or
I totally
webinar
will.
sometime.
I would be happy to do that. All right, that's
Okay.
the end of my slideshow.
So, do you have the animation?
It's not on here.
It was supposed to be there.
I know. This is the end. They only have the top slide.
Okay, so I guess Sally is no longer there, Lauren. All right, so we're just going to keep
Yes, I'm
talking.
here.
So,
I'm here.
yeah, Lauren, Sally isn't around the slot. We're not going to have time now to do the animation. It was supposed to have been at the end of the slide deck.
Okay, well,
Yeah,
maybe we
The
can
animation is
get it
on the
up. Well, maybe we can get it up while I am going through the Q&A. And
Okay.
and we have several questions right now. Maybe we can get that working in the background. If that's
It's
a
not,
possibility.
sure, it's not me, but when Sally sent me the deck, it's not attached. It's not in here. So I don't have it.
Okay.
Yeah. So maybe
Well,
she
let
could.
me maybe
You
you
asked
can
the
talk to Sally in
question.
the background while I'm doing these Q&As.
Yeah,
What
just go ahead
Diana-
with the Q&A. We can do another webinar without the animation.
Oh, okay, that's true too. All right, so we're going to now start taking some of your questions, and I have several that have already emailed me. And if you think of anything right now, you can always submit them in the question box to the right on the panel. My son was diagnosed with PANDAS when he was 7 years old. Now he is 16 years old, and he is still has big episodes of jumping, face twitching or gestures, vocal tics, social anxiety, etc. My question is he going to have these for the rest of his life? Thank you so much. I'm worrying about his future.
Diana, do you want to talk about that?
Well, you're the doctor.
Okay, I will.
You know, I would say that, can I give my honest, well, yeah, I would say that there's a good chance that, yes, there'll be issues for a long time, but the blessing of understanding the mechanisms around PANDAS, and we have this animation that I was going to discuss on the front of our website. It's just right slapped down in the front when you click on it. We know for sure that certain cytokines, autoimmune cells, and certain chemokines that are often really elevated in acute allergies are elevated in our kids' blood. So if you can do anti-inflammatory diets, anti-inflammatory treatments, like, I don't know, you'd have to talk to Amy Smith. She's expert at this, or a doctor who's been around for a long time. There is a way to calm down the autoimmune process and greatly improve a child's life. I know 20-year-old people, I know 35-year-old people who have not had complete remission, but a much happier life with treatment. And sometimes the treatment is longer term rather than short term with a young child, but it's worth working at it. Go ahead, Amy.
Thank you, Diana.
I would say the same thing. I really would. I just agree with Diana.
All right, a second question. I'm wondering if going through with a variety of testing, CBC, thyroid, etc., is worth expensive versus trying diet changes, gluten/dairy, and supplemental herbal antimicrobes to see if improvement is possible without the testing.
Okay, I'm going to respond to that. So I tried that for 3.5 years, and it didn't work because I didn't know what I was treating. And I tried a lot of things. You know, I had a food as medicine practice. So I tried so many things. And I find that if you can, and I understand there's financial constraints to testing. I really do. And there are also ways to get testing for less money than you think. And that is something we can talk about sometime. And it's important. But that the way that I use testing is that the information creates a roadmap that I can actually go in that direction and fix something. And so I highly suggest, if you can do testing, you'll have a better chance of getting there. And you can do other things at the same time. You can still get the inflammation down, right? And you can still change up the diet. But it would help if you know what the trigger is so that you can eliminate it and it won't take your child down.
Okay. Here, Amy, this question is specifically for you. It says, Amy, I have the hardest time telling stemming from PANDAS irregular movement. I'm not sure if I'm saying that right. STIMMING. My son started flapping and jumping around the house for hours after huge PANDAS flare. Neurotypical before that. How come? Could it be autism arriving at age 8 after abrupt onset of PANDAS symptoms? He was not autistic.
You know, it's so unusual to have onset of autism at age 8. It just is. And when I see, whether it's flapping or whatever it looks like, you know, yesterday it was somebody who you thought he was like doing sign language. You know, it's just a different manifestation. There's flapping or clapping or thising or thating. So I wouldn't let the fact that it's flapping throw you off. I would just think these are repetitive behaviors, and they could be tics or they could be compulsions, right? So that would be what I would think about.
Can I add something? There's a new paper out by Yale, and we'll have to do another webinar through PANDAS Network that talks about the basic science that is explaining. Actually, this was all published during the pandemic, so I don't think most of the world knows that Yale and Columbia have discovered similar mechanisms in Tourette's as they're seeing in PANDAS kids. Now, that's a huge statement to make, so scientists don't like that, but Tourette's children have certain antibodies on their brain, in the middle of their brain, that are the same. They look the same as the PANDAS children, and they're in the interneurons, and they're creating repetitive behaviors. When these children in the Yale paper, if you're not sure about the Yale paper, it's on the front of PANDAS Network website. We have a picture of a brain with red color in the center. The Yale paper can be downloaded. But when the IVIG in these kids' cases, I'm not saying all IVIG is the best thing to do, the IVIG was given, the kids' symptoms went away. Bad things on your interneurons, get them away, the symptoms stop. Tourette's, PANDAS, Sydenham, Korea, in fact, Yale, Harvard, and Columbia are doing an investigation of that right now because they're not so sure that Sydenham, Korea, and PANDAS aren't just the same thing. They're not sure. They could be slightly different, but they pretty much probably are quite similar. That's all I can say. So movement can be stopped with anti-inflammatories. We don't have enough neurologists who know what Sydenham chorea is, and they would get mad at me for saying that, but we don't see it in America very often.
Right.
We don't see it.
Thank you. We have quite a lot of questions that just came through, and we're going to try to get through as many as possible, Amy and Diana. But if we don't get through all of them, I think the best would be to forward them to you, the ones we don't get answered, and then we can get back to those folks with the answers if that's okay.
Sure.
But we're gonna go on to the next one and get through, since we only have about 4 or 5 minutes left. What do you think is happening for children who do not relapse and remit, but their changes remain highly problematic without remitting? My son did not get better until IVIG. Have you seen kids like this?
Yes. Yeah, I mean, like I mentioned a couple times, the relapsing and remitting at a certain point when the child's brain just stays inflamed, the remitting part doesn't happen. They just stay at a certain level. The IVIG comes in and it reboots the immune response so that the immune system stops attacking the brain, and then the inflammation can go down.
But
Okay, great. Let me, sorry. Okay, we found strep and muck up during onset of symptoms, treated them. Liability improved, tics improved, then stimming started and is still present. Now, 3 years later, we found Lyme, Babesia anaplasmosis, treating with antibiotics, supposed to treat for at least 1 year. When is it time to just stop killing bugs and go for IVIG? Thank you.
I go by the testing. You know, if it looks like those infections are gone, then by all means, that's the best time to do IVIG. I have found that when something like Lyme or Babesia is present, it can backfire a little bit. The IVIG won't get that reboot, and things don't go as well. So I would do testing, see if it's gone. A year of treatment is a good chunk of time.
All right. Probably have time for one or two more questions. In a severe case, more medical-like symptoms, partisan symptoms, mutism, when and how can you know that treatment, IVIG, Sulfate, is no longer indicated?
In a severe case, when do you know that IVIG is no longer indicated? Is that
Can't do that on.
When and how can you know that treatment is no longer indicated or needed, rather?
That is so complex. There's a million questions that would really need to be looked at. I don't know. I wish I could answer it with any intelligence. Diana, do you have anything to say?
Can I just add something? Well, I'm not going to speak to that exactly, but just like in any illness, some people get rheumatoid arthritis that is crippling. Some people get rheumatoid arthritis that is mild. So at some point you have to discuss with the doctor, this is recalcitrant, this isn't changing. What do we need to think about? Do we need to think about a Celebrex? Not that anybody, not many doctors are doing things like that. An arthritis medication, a chemo type of thing like rituximab. Those are the outlier cases, but they do occur. And I will say that I was speaking with Columbia University today, and they are seeing that these children seem to have an autoimmune gene problem. Not all genes are egregious. Some are mild autoimmune genes. Some are more inflammatory, and that's medicine, right? But I hope you have a really good doctor who can speak to that. Or call Amy.
Okay, I'm gonna do one more, and then we're gonna have to wrap it up. What intervention do you recommend for change gait, holding hands in a cerebral palsy way, and hand flapping that has occurred since PANDAS began and persisted despite major gains in other areas?
How old is that child? I mean, that's.
How old is the child?
Doesn't say.
Oh, it doesn't say.
Amy.
Diana, did you want to answer that? Or, because I'll answer.
Well, I was just something that I'm noticing, and I'm not a doctor, so again, but that the children
He said he's 15. He's 15.
You should call Amy, really. She's not $2,000 an hour or $4,000, some are, you know, and she's treated a lot of older young adults. Amy's is one of the few practitioners who has a lot of experience with that, or older teenagers. But I'll just say, you know, there's a couple kids that have more gait issues that I've been following. 2 children I've been following for about 3 years, and they do best. They're doing better with plasmapheresis. And I hate to say that because it's really hard to get. It's very difficult to get. And that you really should call Amy or a neurologist to understand what plasmapheresis is used for. It's used for gait disorders associated with Sydenham chorea often, but not all gait disorders. Your son might have something else. But if it's infectious triggered, we're seeing with those children that pheresis is working better.
Thank you, ladies. What I'm going to do with the remainder of the questions is get them and then ask you, ladies, the answers to them, and then we're going to post them on the website so that patients and parents can have them as a resource later. But we're going to wrap this webinar up right quick. Diana, Amy, thank you so much for being here this evening with us. And I want to thank you, the listeners, this evening. We hope you will join us for our next educational webinar on November 10th from 3:30 to 5:30 with myself and guest speaker, Dr. Megan Spicala, as we discuss Clinical Trials 101 what to know as you consider participation, and also tricks and hacks for navigating the prior authorization process.
Oh, everyone
Also,
should join that one.
I also wanted to remind our audience that to obtain the certificate of attendance that is on the panel as well. Thank you so much again, ladies, and our audience, and we hope that you have a great evening. This is Lauren Dunlap for Advocacy and Awareness for Immune Disorders Association, and we hope you have a great and healthy day. Thank you.
Thank you.
Thank you.